we can't rely on our governments. We need to have popular mobilization around access to medicines. So there is this suggestion being debated that we should have a pandemic treaty, and that a kind of new legal framework that says, okay, when we really have an emergency, then we'll have this pandemic treaty, and then that treaty will say for sure trips will be suspended, and for sure everyone will have equitable access to medicines. So let me ask you, what's your take on it? Do you think that's a feasible response, or you're not so convinced, or it can work if we mobilize? What do you think?
It's difficult to respond to that in any positive way at the moment. I think for those of us who've attended health meetings and conferences over the last 10 years, I think every single meeting that I went to had a WHO sponsored session on pandemics. There was always a side meeting. There was always discussions that, we're waiting for the next pandemic. I think they were expecting it to be something more like the influenza and not the coronavirus. But there have been discussions on this for the last 10 years. And it turns out that the plan was that there was no plan, by the end of it, because if you remember in the first 3 to 6 months, even the institutions were scrambling and nobody knew what to do. So after 10 years of having heard this pandemic preparedness discussion going on, it seems that there was actually no plan. So this pandemic treaty conversation has been going around. I think it's something that we have to watch very, very closely, because if we're not being able to force pharma right now to let go of the technology to allow others to be able to produce medicines and vaccines and masks and to have global access to it in the moment of this emergency, I'm not sure what's going to happen with this treaty and these negotiations as we go down the lane. Subingile was talking about how TAC mobilized around the German embassy to try and pressure Germany and ask them why they were opposing the TRIPS waiver and to get them to back down. If we're not going to be able to move these countries right now, we can just imagine what the state of these pandemic treaty negotiations are actually going to be. I think it's true that global solidarity was the most important and the biggest missing factor in this pandemic. Whether this treaty, which relies on negotiations by developed countries that are thwarting every move our governments and our communities are making to access medicines right now, how they're going to play out in negotiations. International institutions are compromised by their reliance on pharmaceutical companies and private foundations. So yeah, I think I'm a little cynical about how these negotiations will turn out. That's not to say that community groups and health groups should not be engaging with it and ensuring that we try and make sure these negotiations go in the right direction. But yeah, I apologize. My cynicism is the overwhelming feeling that I have these days. And
No problem. I mean, I think I smile and I laugh, but I think it's understandable because literally millions of people are dying. And since October 2020, we're still debating whether there should be a waiver for COVID-19. So
exactly. Yeah.
Yeah.